Thank you all for being here. It's a real pleasure to kick off a series of Latin America and Caribbean um, colloquium sessions. And here for this EMO colloquium, which is one of our flagship events for EMO Bridges. I'll talk more about this in a second. I wanted to actually, more than anything else, give a shout out to our team that's helping us organize all of this. Some of you might have heard this banter that we were having right before, but really all this would not be possible. The colloquium series in particular, where if it were not for the support that we have, especially from Felipe and Berastegui Grunewald, who's here with us right now. And this is the first of a series of 3 colloquiums that are based on bridging theory and practice in Latin America in the build-up to our conference, which is going to be in San Luis Potosí at the end of October. And I'll talk more about this in a second. So without further ado, let me just share my screen. And I promise I won't be doing too much talking today. For those of you who don't know me, I'm Francisco Marmolejo Posillo. I'm the Director of Partnerships for EMO, postdoctoral fellow at Harvard, incoming assistant professor at Boston College in Computer Science, and a longtime fan of EMO, my academic home. So it's really wonderful to be hosting this colloquium that is going to be of great impact to my home, my Latin America and the Caribbean in particular. So I hope that this can serve as a good discussion point in the lead up for the conference that we'll have. So without further ado, today's session is on public health and environmental risk factors in Mexico. And so the outline for today is I will give a very brief overview of what a new event that we're having at the EMO conference, which is called the Social Hackathon. I'll delve into this. I'll talk about why we're doing this. And in the process, actually, I'm going to go, for those of you who already know a bit about the history of EMO, I apologize for a bit of the recap, but mostly thinking about this to contextualize what this new activity is that we're doing and where it comes from. And from there, we're going to pivot to a presentation by Dr. Jacqueline Calderón on a novel data set that she's prepared in preparation for the Social Hackathon, which is linking environmental risk factors to breast cancer. And then we're going to have a panel discussion with multiple esteemed panelists from various areas of research, from public health to practice to economics, Doctora Jacqueline Calderón, Dr. Daniela Costa Díaz de León, Dr. Imelda Flores Vasquez, and Dr. Willy Tonatiuh Escalante Silva, which again I'll present everyone later on. It's just a kind of a teaser for what we'll have later in today's session. And so just to begin, I want to quickly talk about, I realize there's a little, apologize for that little line that's there. I don't know why that's there. So what is EMO? EMO is a nonprofit fostering research and practical work in the name of the organization being equity and access in algorithms, mechanisms, and optimization. And for those of you who might not be, I realize actually for this talk, we have many people who aren't as familiar with EMO, with our mission, with what we do. So our mission is to build a research community that places the perspectives and interests of marginalized communities at the forefront, at the foundation of methodologies within algorithms, within resource allocation systems, within STEM, and all of these tools that are of high practical relevance in today's world. And our focus is precisely on creating tools for and by impacted communities. And again, emphasizing this totality of the research to practice pipeline. And all of these are actually fundamental aspects of what has inspired the Social Hackathon, which I'll delve into in a couple of slides. But EMO, the research initiative, was founded, and for those of you who might know, historically was previously the mechanism design for Social Good Initiative, founded in 2016. And again, just to recap the goals of the community, we're a community of more than 4,000 researchers now from various fields and disciplines, and we build a community with diverse perspectives around technical systems. And we bridge research and practice, as I mentioned. The initiative of the Social Hackathon is focused on precisely bridging research and practice in the public health domain. And we prioritize outreach to impacted communities, again, hearkening back to what I mentioned before of making tools for and by impacted communities to actually be of relevance to those that will use the tools at the end of the day. And ultimately, we innovate over infrastructure. And I want to emphasize this point because it's infrastructure not just in the actual technology itself, but also in the meta research process, in the actual process of creating research and flourishing these new academic communities. And precisely the Social Hackathon, which I'm going to talk about, is an innovation in the infrastructure around research in the first place. And so the EMO structure of the overall, now we're a nonprofit, is really of two major arms. The first arm is that of EMO bridges, which is what was previously known as MD4SG. And I like to think about this as the motor of work that happens at EMO. This is what some of the activities of EMO bridges that are most important are, for example, this colloquium series, where we highlight important work at the intersection of theory and practice. Other important aspects of EMO bridges are working groups, where individuals come together over specific themes that are fundamentally complicated and interdisciplinary. And this year, for example, we have themes ranging from environment and to algorithms, law, and policy, to indigenous communities in the Americas. So it's a specific lens that we bring multiple researchers together to innovate over and to find commonalities in complicated social structures and social problems that we can help benefit in the long term. And the other activity that we have at EMO is that of the conference. So we have, for those of you who aren't computer scientists, actually within computer science, the bulk of publication happens at conferences. The ACM, the Association of Computing Machinery, being actually an umbrella of highly prestigious international conferences. And so essentially we have a means of publication, a forum of academic currency that is now in its 4th year. And this year, we're very happy to be partnering with multiple institutions from San Luis Potosí to be hosting the conference in Mexico in an effort to really put access in the name of equity and access for the conference. And it'll be near the end of October. It's close to Day of the Dead, a really wonderful time to be in San Luis Potosí. We're very excited, and we hope that many of you here can potentially join us at our conference. And so now, without further ado, I want to just end by talking about what is the Social Hackathon. This is what's bringing us together today. So the Social Hackathon is something that we're really bringing, it's a new idea that we're bringing to the conference, where we want this to be more than a competition. We want this to be a call to action for the EMO community to harness the power of algorithms, optimization, and mechanism design, the tools, the technological tools that many of us in this community have, with insights from social sciences to tackle specific social issues. And the idea and the fundamental philosophy of the behind the Social Hackathon is that the EMO conference, beyond just simply being in different places, can leave a positive footprint in the long term for where the conference is. We want to bring actual tangible outputs to the communities in which we take the conference. And so in this vein, local partners, in our case, the Doctora Jacqueline Calderón, provide curated data sets and extensive context on issues that are important in local communities. We'll see shortly that the issue that we've chosen is that of breast cancer in San Luis Potosí and Mexico, to incorporate impact from policymakers, communities, and local experts to try and contextualize ways in which we can then harness the community to create practical tools to bridge the research to practice pipeline, to really leave a footprint in our communities. And the idea is that teams will come up with tools that can potentially be used in the long term by policymakers in the region in which the conference will take place, and will help winning teams incorporate their solutions in the long term. And so this year's challenge is that of breast cancer in Mexico. And I don't want to go too much into the details to this because Doctora Calderón is going to actually delve into much more detail for this. But it's the most common breast cancer in women in Mexico, with a very large incidence in Mexico. And in fact, certain areas such as Mérida, for example, even larger incidence than the national mean. And more importantly, there are significant links in education levels, socioeconomic status, that link to breast cancer prognosis. And one of the main focus points of a data set that's been curated by Doctora Calderón is that there's evidence that's linking contaminants, pollution sources, to increased incidences of cancer, and in particular for breast cancer, which is an interesting data point and perspective that we can take for the uniqueness of this context in the San Luis Potosí context, the Mexican context, that can help us guide the tools that we create in the hackathon. And I just want to give a brief overview of the data set that has been prepared. It's a data set that's monitoring environmental contaminants such as air emissions, water quality, chemical substances such as benzene, arsenic, asbestos. They're geotagged different locations of these sources. It has socioeconomic data such as demographics, health services surveys, and migrant households, and breast cancer mortality at locality levels. And here, for example, is a map of the contaminant sources within the data set that's been curated by Doctora Calderón, as an example. And these are all from sources from publicly available data sets that have been curated as a way to give inspiration to potential tools that we can create for this hackathon. And so just some final logistical details. I hope my scribbles don't mess with this QR code. but we've partnered with Open South, which is led by Dr. Giorgio Baido from UC Berkeley, a platform for sharing data in the Global South. We're launching the Social Hackathon for precisely this colloquium today. When we're hoping to, the website has more details, but teams create submissions from now until late September in the nature of demo submissions, so prototypes of tools that can be used by policymakers in the modality of the EAAMO conference. And we have multiple rewards as well for participation in the hackathon, such as teams that register get virtual registrations to the conference. We will be picking 3 finalists amongst the registrations to receive a travel grant to come to the conference and present before a jury of experts in public health, computer science, and in the EAAMO research community, where ideally there are prizes for the winners of the hackathon and follow up after the conference to implement these tools, these prototypes in the long term for local communities in San Luis Potosí. And I just want to give a shout out to some of the organizing team that has been helping me with kicking off this inaugural social hackathon. Jacqueline, of course, has been wonderful. There's been George, who I mentioned for Open South. This would all, of course, Salvador Ruiz Correa and Rubén López Revilla have been instrumental in getting EPC support and helping us understand a bit more of the context. Sandro goes without mentioning, and we have Lisette Yarkin Yanez from CONACYT SLP who's been helping us too. And so thank you. That's, I guess, my little spiel right now for the first 5 minutes. I realized I probably talked a little bit too long, but I want to pass the baton on to Doctora Jacqueline Calderón, who's going to talk to us more specifically about the medical side of this contaminant and breast cancer incidence link. Thank you so much. I'll stop sharing and let you share.
Okay. Thank you so much, Francisco, for this, for the information about what are our objectives with this colloquium. Okay, I just going to start to share. Okay, it's good. Okay, so the main objective of this conversation is that we are going to try to reveal what are the disparities about chemical exposure, and in this case, the breast cancer as our final outcome. I don't know why I can't move. Okay. Well, here is the outline. So first, I'm going to talk about the breast cancer metrics in Mexico, following by the risk factors that are already identified in the scientific literature. And the third point is the data in action. So we need to visualize the inequities and the inequalities in both sides, the disease and the environmental risk. And of course, we are moving to the digital innovation, how we can include the digital innovation in the health policy agenda. And finally, some conclusions and the acknowledgement. So this, we started, my team and I, we started in 2017 working on chemicals and social risk, trying to identify patterns of the disease, not just breast cancer, or we have some experience with chronic renal disease of unknown etiology and some cognitive deficits in children. So we started working with, we have been working with other collaborators. I'm glad that we are making a great contribution with the people from the population cancer-based registers from Mérida, from Puebla, and La Paz in Baja California Sur. So these population cancer register are in Mexico. And finally, we were able in 2022 to talk with people who do different things that we usually do in the area of epidemiology and environment. We start our conversation with scientists in the field of artificial intelligence, and so we started this collaboration with the Instituto Mexicano del Seguro Social, people from research science, scientists from the intelligence artificial, and the idea was to create this National Observatory of Cancer and Environment. We are moving, others actors are working, are joining us. This initiative is one part of this collaboration. So we need the data that I'm going to present here are part of the results that we have analyzed from the National Observatory on Cancer and Environment. These are data from mortality data from routine health statistics. And as we mentioned before, the breast cancer is the #1 cancer for Mexican women. Between around 15 of every 100 cancer deaths are from breast cancer. And what is interesting and that we are focused on is that the mortality rate is rising in women. These data are only for women over 20 years old, are Mexican women, and the source is these results that we got from this National Cancer Observatory. It is relevant that we have this observatory because usually the data that are reported for Mexican population are from the international, for example, the World Health Organization with this Global Cancer Observatory. So we need to improve our strategy to analyze our own data. And so this is some of the points that I want to highlight in this slide. So also we have trying to identify where this mortality, where are the areas where we have the highest risk for the mortality. And in this map, we can identify these municipalities. So now we are able to analyze information at national, state, and municipal level. So in the right side of the slide, we have the information about the data, the mortality data in San Luis Potosí. And I just pick up the 7 municipalities with the highest mortality rates that are the city of San Luis Potosí, the Soledad de Graciano Sanchez, and we have these 4 and 6 that is an agricultural area in the middle area of the state. And this is the Ciudad Valles, and we have Matehuala also. So these municipalities are completely different about their socioeconomical activities, about their social conditions, and also they are very different about their chemical profiles. Here is just to highlight that, for example, we identified in these 7 municipalities that for women, we haven't had any improvement in the reducing the mortality rates, for example, in women in the age group between 35 and 39 years. So this is, for example, we can see in the 40 to 44 years that we still having the comparison between 2000 and 2020, that we still having the mortality is rising. So this is for San Luis Potosí. It's not different. It's similar. The patterns are similar that we see in the national level. One of the important things that I want to mention here is that in Mexico we have some breast cancer prevention initiatives from different organizations, from the Instituto Mexicano del Seguro Social. They have this health promotion program. Also, there are some breast cancer screening units that that are located in different states of the Mexican country, of the country of Mexico. But the problem is that we do not have cover. There is not cover in the whole country. So these initiatives, from my point of view, they need to be strengthened with new strategies. About how is the role of environmental chemicals exposures and the contribution to the disease. This information is from the Global Burden of the Disease. It's 2015 study. And they show that in countries, in lower and middle income countries, the main risk factor related with non-communicable disease is pollution. So this is the pink bar that we can see here, and Mexico is in this position. So Mexico, one of the important topics about our economical activities is that 70% of the industry is located in countries like Mexico, and Latin America. So we have a problem because we have a high exposure to environmental pollutions. We have flexible legislation, and we do not have these systems to record or have complete information in our data sets about the disease. So that is why this initiative is very important, where we will be able to put together all the pieces in order that we can visualize the magnitude of the problem. So this is a representation about how the environment, the external environment, impacts to health of the population. So these different exposures that we have regarding lifestyle, the socioeconomic status, and the chemical, biological, or physical environmental risk, they have an impact, an influence on the internal response. But this internal response is finally we can see as an end out point as a disease. So in this is not cancer the only endpoint, the only outcome that is related with the environmental exposure. So we can have all other diseases that are related with this condition. The problem is that we do not have been able to clearly identify where these environmental pollutants are, what are the sources, and how much do they contribute with the burden of the disease. This is, in the case of breast cancer, we, for this, to prepare this slide, we conduct a research to integrate information from scientific reports. And there are risk factors that are well known. For example, lifestyle factors related with breast cancer, like smoking, alcohol consumption. And there are other physiological risk factors also well known and well documented and easily to identify. And there is the occupational exposure to carcinogens. Some women are exposed involuntarily, even in their occupational settings. But about also they can identify what is the process and what are the substances where they are exposed. But also there are some environmental risks that usually we do not have any key about where they are and how we can prevent and how we can identify to avoid them and reduce eventually the burden of the disease. So we are focused on the strategy to identify these environmental risk, to focus on cancer prevention, because usually the cancer prevention in the healthcare system is focused from inside the hospital, early detection and promptly treatment of the disease. But we are looking in the other part, what is going on in the community and how we can contribute with the prevention strategy. So in the last, it's not a new topic, the breast cancer and the chemical exposures. So there's a lot of information about how the chemicals contribute with the disease. For example, this study in 2021, they identified 300 chemicals. Most of them are in some consumer products. And the number of the substances related with breast cancer is still rising with the research. So one of the sources that we have to classify the chemicals as a carcinogens is the information are the monographies, cancer monographies from the IRC, the International Agency for Research Cancer. But I want to mention here that usually this information is not easy to be updated because so far we have 23 monographies of cancer, and we still haven't over 1,000 substances, chemical substances that haven't been classified. So here I want to show that, for example, In 2012, we have the 100 supplemental. So there is a gap, and we need to reduce the time between the information is released, the scientific information, and the time that this information is included to take action. So we have a challenge how to prioritize this risk. And in the case of the breast cancer, the question is, where do we start? So we decided to start with the carcinogens that are released from the industrial sources, because the industrial sources have an impact, are one of the most relevant sources in a country like Mexico. There are chemical mixtures, several environmental media are impacted, air, salt, water, and usually the urban areas are very densely populated. So it's something that we need to analyze how these chemical industries are contributed with the burden of the disease. So one of our expectations for this colloquium is to try to construct a strategy where we will be able to identify where the emission sources are, what are the impacted media, where the media are impacted. We are focusing mainly on air and water because are the most important media for general population. And finally, try to identify where these population are, how is the distribution of the population in the geographical context, and classify according their age, their sex, or the basically these demographics. So we have created this, we have integrated this information from data from federal agencies in Mexico. We integrated these industrial carcinogens chemicals, and we label them as a carcinogens, but also we advanced labeling them as a carcinogens that are positive or are associated with breast cancer. So that's one of our main objectives during this, that we will be able to get together this information. And also, one of the things that we need to construct is this environmental public health tracking system. So this is not from us, this is a proposal from the Center for Disease Control and Prevention from the CDC. And basically, the most important part is that we will be able to link the hazards, the exposures, this data, because the data, if they are in storage in a hospital or in a governmental agency, we need to use this data. So we need to put in action the data, and thinking about how we are going to collect the data with a purpose to conduct surveillance. How we integrate this information, this is one of the biggest challenges that we have found in this during this research strategy. The analysis strategies that we can use. We are lucky now because there are geographical information system. There are many developments in spatial statistics, and now these mathematical algorithms that can be used for the analysis and also for the interpretation of the data. And one of the also the objectives is that we will be able to disseminate this information for the stakeholders. So in this case, and for this meeting today, we have the assistance of people at the state and local agencies to make the policymakers. And our final objective is to improve the public health. So we need to work together to assemble these data sets and share the data, but also to create innovative and different ways to monitoring and to improve the public health. I think I'm not. If we traditionally in the way that we use to identify the risk in the population are through epidemiological studies, but usually in a country, for example, in a country like Mexico, the resources are limited. We do not have enough data sets. So if we want to take decisions based on information that we are generating through scientific projects, maybe it's going to take like maybe 10 or 15 years. So we need to reduce the time between the information is produced, published, and put in action. Another of the objectives is to visualize where these chemical hazards are happening and what is the distribution of the disease. This solution is not only for breast cancer, so we can monitor in any kind of disease, because there is enormous evidence, scientific evidence, about the contribution of the chemical burdens and the disease. The WHO state that for around 24-25% of the burden of the disease is related with environmental pollution. And in children, this proportion is higher, it's over 35. So we need to put the data in action, and that is why exactly we're doing here. We created these data sets from information from the scientific evidence, sociodemographic data, point and mobile sources data, information from the federal agencies, and the routine health statistics. So far, we only have the information about mortality that are open for open consulting. But of course, we will we will want to have the possibility to connect with the population and the hospital register. So it will be fantastic that we'll be able to collaborate directly with the information that are produced in the hospitals. So we have many challenges trying to integrate data. I am not going to go deep in this because it's we have different sources and different ways to get the information, and some of the times information is not compatible. So we need also to work how we can use information that we have in countries like Mexico. If we are waiting to have the whole picture or the complete data sets to do something, maybe it will be take I don't know, maybe 3, 4, or maybe 5 decades. So we need to work and to act now. So here I am going to present a case study about what we have done with this multidisciplinary project with the Instituto Mexicano del Seguro Social and the Population Cancer-Based Register in Mérida. And basically, these are the data from the last 12 years old, as breast cancer data. And here we can see that the cases are increasing and are being diagnosed in early ages. Of course, the environment do not explain the 100% of the disease, but the scientific literature says that only less than 20% can be explained by genetic factors. So, or we are focused on what is the contribution of environmental chemicals. And also this is the increment of the disease around the time. And here there is like a slight reduction of the cases. So so far we were able to identify where these cases are occurring. And in Mérida, it's an interesting case study because it's not a heavily industrialized area. It's low. Many people in Mexico consider that Mérida is one of the best places to live in the country, but we will able to identify where this red area is where most of the cases are happening in the city. And also we included information about industrial emissions that are, for example, in this case, we are representing the emission of arsenic and cadmium that are already labeled as a carcinogens for humans. And there is evidence that they can be linked with the development of breast cancer. So this is one of our first strategies to visualize where the disease is happening and where the distribution of the sources are located. This is only industrial sources, so it's not the whole picture of the sources that we have in the city. For the data sets that we are going to share and to analyze in this hackathon, we have other point sources that can be included to trying to explain what is the scenario, the carcinogen in Mérida, in other cities of the country. So we will be able to identify with media are impacted, air, soil, or water. And in this slide, it's very interesting because this is the whole state of Yucatan. And here we were able to include the PM 2.5, that is a very common pollutant, and also is related or associated with the not just breast cancer, with other non-chronic disease like cardiovascular disease. And we were able to use these layers of information and to identify where the other industries or what is happening in the sorry, what is the situation in the city, the situation about the chemical distribution. So here we can identify where there's manufacturing of the cement, generation of electrical energy, metallurgical, petroleum and petrochemical industries. Also, other sources of pollutants like airports, of heavy highways are important sources of pollutants. And of course, we are interested to including where the health services are, because the accessibility is one of the important. It's very important to have accessibility for the health, for the prevention of the disease. So basically, what we are trying to do here is to reduce this gap between, or try to put together the information in environmental science with the clinical practice. So we are interested in creating these environmental and occupational carcinogen exposure histories, develop counseling solutions based on evidence to literate the patients about the environmental risks that they can avoid, or also to empower the population to make smart decisions, because some of these diseases that are related with environmental exposures can be reduced, but can be preventable if we know where the risk is, and if we know where the strategies, if we know strategies to reduce the exposure. So finally, we have great opportunities for innovation in the healthcare sector, but our vision has been mainly focused on inside the hospital, for treatment, for diagnosis, from improving the all related with the pharmaceutical industry. But our main interest is how we can link or we can create these social innovations that can be used to empower the patients or the cases or the population, and to give support with these risks that usually are unknown. So here is just a list of opportunities that the healthcare sector can have to improve. But one of the needs that we have is that the data must be shared with other specialists, in order that we will be able to know more about what the data are trying to say, to tell us, and trying to find solutions together. And finally, this is a call for action. To preserve the health of the population in Mexico is not only responsible of the healthcare sector, the industry, the economic activities, other government agencies like Semarnat, COFEPRIS, they have a huge responsibility. Research and development, the academia and the communities, everything. We need to work together if we want to improve the health of our population. So we need to create innovative ways to translate this evidence for the decision makers, for the communities, and for the individuals. If we have and put together this information, we will be able to release on time in order to prevent the disease. So this is just an idea about a dashboard about, regarding cancer and environment that we will be able to create. We need to integrate the databases with the focus on using the geographical information system. We already have the inventories of chemical sources, the commercial activities that are responsible for emission of carcinogens. We need to include these geodatabases of the incidence of the disease. We need to know where the healthcare units are. Also, we need to develop some digital solutions, counseling to reduce the risk, the emotional support in a disease like cancer, to generate innovative ways for syndromic surveillance, environmental clinical histories, and find these pathways for medical attention, how we can reduce the time between one person have the first symptoms and the time until they are treated and diagnosed and treated. And of course, to include this part of the prediction, the modeling, the use of these artificial intelligence strategies like machine learning, modeling this aggregated and accumulated risk, and to create these preventive models in order that we will be able to develop preventive strategies more focused in the local situation, not something that WHO says or organization outside of real needs. So we need to identify the key actors, not just for the risk, also the actors in the society and in the government that will help us with the risk reduction. So finally, is just that we need to think how we translate the science for the society. In this case, we were working, I presented information about cancer deaths, women who died from cancer, and we need to give power them to protect their health, and of course, to protect our, in general, not just women. If women are protected, I'm convinced that children will be protected and the men will be protected. So thank you for your attention.
Thank you so much, Doctora Calderón. That was a really wonderful, spectacular presentation.